They call hypertension the silent killer because it'll creep up on you in the dead of the night and just take your life. So I'm going to review the dangers of hypertension here. I'm going to tell you what's normal and abnormal, the signs and symptoms, the complications, who's at risk, the diagnosis, and treatment of. So, abnormal and normal. According to Van Ditu and Healthline, the normal systolic is between 90 and 120, while the normal diastolic is 60 to 80, and the mean arterial pressure normal is between 70 and 100 for proper perfusion. You consider it elevated if it's 121 to 129 systolic, stage 1 if it's 130 to 139, stage 2 if it's above 140. As far as diastolic, 81 to 89 is stage 1 and over 90 is stage 2. Signs and symptoms, according to the CDC, it can be no symptoms at all to very minor symptoms. According to Dr. Weber of Valley Well Health, the minor symptoms could be anything as recurrent headaches, nosebleeds, shortness of breath, or dizziness. Possible complications, according to the Mayo Clinic, are heart attack, stroke, aneurysm, heart failure, weakened or narrowed blood vessels in the kidneys or eyes, which could cause vision loss, metabolic syndrome causing the development of diabetes, trouble with memory and understanding, and even dementia. So the way that it works is basically your blood pressure is so high that your blood is moving so quickly through your vessels that the smaller vessels are getting injured or ruptured, and then you have lack of blood flow to an area, which is known as ischemia. And another possible scenario is you have plaque buildup on the side of an artery or vein and it gets dislodged, and then it can make its way to the heart or the brain and clog something up over there, causing that heart attack or stroke or just damage from ischemia. Who is at risk? According to the Mayo Clinic, contributing risk factors are age, race, family history, weight, sedentary lifestyle, use of tobacco or alcohol, stress, pregnancy, poor diet, to include too much sodium or not enough potassium, certain medical conditions, and medications. Diagnosis and treatment, according to Osmosis EDU, the diagnosis of hypertension can be determined with simply taking vitals and blood work, but certain diseases can show signs of secondary hypertension that are linked to the original disease. Treatment can start with something as simple as lifestyle change and something as complicated as pharmacological assistance or medicine. You have alpha 1, beta blockers, ACE inhibitors, renin inhibitors. You have diuretics that work by inhibiting ADH, your antidiuretic hormone. It's all just trying to make sure that your blood pressure stays within a normal range. In summary, high blood pressure is defined as a systolic over 129, a diastolic over 80, or a mean arterial pressure over 100. Hypertension is known as the silent killer, being undetectable at times and sometimes present only with minor symptoms like a recurrent headache. It has the ability to cause major events like dementia, heart attacks, and strokes, but also non-life-threatening things like kidney trouble, memory trouble, and development of diabetes. Major risk factors are mostly controlled by living a healthy lifestyle and being aware of the demographics to give you better odds to detect it early on. These are my citations. Thank you very much. And that is hypertension or high blood pressure.